Good evening. It's nice to be here. This week I've got a couple of new messages, and they're not all that good. One is, any patient who's now a pain patient in this country is going to have to face the practical message that Washington, D.C., coming from the Congress, the President, the Department of Justice, coming on down through DEA and his U.S. attorneys, are simply not going to accept high-dose opioid therapy in this country. And so patients who are on high-dose opioid therapy, despite the fact that they may be doing very well and that they are needed, it is just not politically acceptable. Scientifically it is, clinically it is. People are functioning very well with high dosages. We know how to do it. We know it's needed. We know people have genetic variations. We know they have underlying diseases. But it's not acceptable politically in this country at this time. And so my message is that patients need to find doctors who will at least give them some opioids, some agents, but they're going to have to find every alternative they can, explore everything. Herbs, botanicals, hormones, oxytocin, ketamine. Try to start bringing your opioid dosage down to where you'll get some help. That's a bad message, but at this point, I don't see that pain patients and us doctors have the influence politically to change the tide, and that's a sad message. Now, the second message I have is, if we're going to change the tide, it's going to have to come through the political mechanism. Now, politics means that facts mean nothing, perceptions mean everything, and power means everything. And I would encourage pain patients and their physicians, their nurses, and everybody else around them to understand that they need to start going to their congressman, their senator, and see if you can strike a tone. Because other than that, we're lost. So anyway, at this point, and maybe it's money, maybe it's power, I'm not certain. When you're starting to talk about Washington, D.C. these days, you're talking about a pretty chaotic mess in which facts don't mean anything, power seems to mean everything, and they have made a decision collectively. And I think it's both political parties. I think it's everybody. And that is that that they are just not going to accept high-dose opioid therapy in this country. And I think a lot of that has to do with this. You know, it's real easy to treat patients all the same. You know, one size fits all. You can give them a standard packet of pills, a standard dosages, standard drugs, standard everything. And that's where the money is made, to be honest about it. But that's what I see this week. Again, I'll close out. Number one, patients have got to be practical, and their families have got to be practical. You're going to have to be able to get what opioids you can, but the high-dose opioid therapy is just something that they won't accept. And let me tell you something else that I find incredible. They're giving you the line that if you take high-dose opioid therapies, you're either selling your drugs, you're overdosing on your drugs, or you're harming yourself. And none of those things may be true. We've known for years that a lot of people can take high-dose opioids. They function very well. Their heart gets better, their brain gets better, their body gets better. We know all of this. They know all of it too. So they're not interested in hearing the facts about this. They just want the dosages down. Some of it's money, but some of it's power, and some of it is big health companies, whether it's drugstore chains like CVS's or big HMOs like Kaiser or big plans like Aetna. They just want cheap cookie book medicines for everything these days. And so patients are going to have to learn to take what you can from the system, but develop something outside the system for your own health. That's my message there. And secondly, start organizing politically. If you want a future to have pain treated as an individual therapy for each patient, as I think it should be, that's going to take a political change in Washington. And it's going to be the Congress of the United States. You've got to remember something. Everybody these days is blaming DEA, the state medical board, the U.S. attorneys, Blue Cross. That's not the case at all. It's coming right from the President and the Congress of the United States. That's where the power is. They've made the decision that what they want in pain treatment, and so you're going to have to go with that. Anyway, I'll sign off and hope to talk to you next week.
There you go.